I'm so aggravated right now because I just filmed a, I think like 15-minute discussion on my spinal fusion and the journey up to my surgery, and I somehow pressed time lapse or something. That's what I get for doing it on the iPad. I'm 31 and I had a had decompression and fusion on my L5-S1 vertebrae, and going to be talking about my surgery and my recovery. So today is September 11th, 2019. I am 8 weeks post-op today. I had my surgery on July 17th, 2019. My surgeon said when he got in there, the disc was pretty much gone, just about bone rubbing on bone. So my disc had degenerated a lot. I woke up from anesthesia. I didn't have a sore throat or anything. My throat was dry, but I didn't have a sore throat from being intubated. I did wake up in a good amount of pain. I'm not going to say excruciating. I was in and out. I don't really remember a lot. I just remember, you know, being in a lot of pain. They hooked me up to morphine. I was on a morphine pump for the night. I woke up with no nerve pain, no hip pain like I had previously. I just woke up with a lot of numbness in both of my legs, basically from my hips all the way down to my feet. I woke up with numbness, but I was told that's normal. I only stayed in the hospital for 24 hours, then I was released because I was using the bathroom and walking and everything. Speaking of bathroom, I know a lot of people, I was even afraid of a catheter. They sedated me, put me under, and then put the catheter in and intubated me. Anyway, the catheter was out. When I woke up, I asked my doctor before surgery, before they wheeled me in, and he was saying that that's what they do. Probably because I was just a one-level fusion, probably figured that I would be able to get up after a few hours, and I did go to the bathroom assisted. That's a whole nother adventure after surgery. You can't even wipe on your own, at least I couldn't. Pulling your pants up. Whew. Anyway, I had a drain in my back that was a little bit above my incision that was taken out before I was discharged. Didn't hurt. It was interesting feeling, but it didn't hurt. I got home and I had like the best sleep of my life the first couple of days. The first 2 days after surgery were horrible. I look back on it now and I think, oh, it wasn't that bad, but no, it really was. It was really scary. I'm an independent person. I like to move on my own. I couldn't move. My back just felt like my butt was made of lead. It felt so heavy. It felt like my butt could just was so heavy it would rip off. Obviously that feeling does go away. It takes a couple of weeks, but it goes away. Like I said before, hard to wipe, hard to just bend a little bit in general, like to just wash your hands and brush your teeth. It really hurts. Showers, you don't take a lot of those. I mean, you're really not like sweating and doing cardio and moving around a lot anyway, so save yourself the trouble and wait on that shower. I washed my hair like once a week. I think I took a shower like maybe twice in 1 week. Don't say ew, because unless you've had the surgery and are going through that, you're probably not going to take a shower either. Let me say this. I want to tell you what I recommend you get if you are in preparation for surgery. These are the things that helped me. A grabber, a walker. I used a walker for the first week, and then after that I was done with it. I would suggest getting a little puff on a stick to help reach your feet, because I couldn't even wash my own feet. I just like 2 weeks ago, I'm really more flexible now and I can wash my feet better. Just getting down to those bendable areas that you're not supposed to bend and it hurts anyway. Maybe get a bed rail. I didn't get that, but I know that does help a lot of people. A lot of people can't sleep in their own bed after surgery until they're healed more. Some people sleep in recliners. Some people sleep in zero gravity chairs, cots. I mean, whatever you can find comfortable to sleep in, that's what you should sleep in. I know that I couldn't really lay on my back too much. Just even sitting in a chair, I couldn't put pressure on my back. My husband would ask, do you want to put a pillow in between you when you're sitting on the couch? No, I don't want anything touching my back. Also, after surgery, you know, they're cutting all those major muscles in your back. I didn't have minimally invasive surgery. I had incision that, you know, is a few inches long. I would say 6 inches. I'm going to insert a picture. I lost my train of thought. My husband and my mom flew in. We have no family where we live. So my husband did take off work for 2 weeks. My mom was here to help take care of the kids so I could rest. And I had help for a month. And then after that, I was on my own with the kids. It was still summertime, so it was a week before school started. It was hard, but I got through it. I was just glad that I had a month to actually relax and rest when I needed to and have help. About 6 days, 5 or 6 days after my surgery, I started getting nerve pain again. The numbness was going away, but I had the nerve pain in my left foot, which is the opposite foot of where I had more pain in my right leg throughout those years. And just the last couple of weeks before surgery, I started having pain in both legs. Anyway, so I had a horrible pain in my left leg, my left foot really. So when it started coming on, it felt like my skin was raw. It felt like a sunburn or like somebody was scratching me. It was on the top of my foot, and then it got worse. There was it felt like a vein pulsating on the top of my foot, and also on the inside where my heel is, that I had the nerve pain too. And my foot was so swollen I could hardly touch it. Just my skin rubbing up against anything, it hurt. You know how when your foot goes numb and it's waking up basically, and there's numbness and tingling at the same time, and when you barely touch something, it's like, oh wow, that's how it felt. That has gone away now. I still have some nerve pain when I'm bending too much and moving around a lot. Now I can stand for longer. I can stand for a couple hours, where before I couldn't stand for more than 30 minutes without being in a lot of pain. I can move around in bed without shooting pain down my legs. I still have nerve pain, so sometimes it bothers my foot in the morning, but just getting to the bathroom was awful. Walking to get my son from school was terrible. Just a lot of pain. If you're thinking about surgery, you don't want to go through with it until the pain, you can't walk anymore. Exhaust every conservative method. Don't do like I did and not see a doctor for 6 years when you have chronic back pain, because everybody's telling you that you can't possibly have any major back problems going wrong. You're only 24, 25 years old. I mean, there could be nothing wrong with you. Everybody has a little back pain.
So I realized after editing this video that I didn't end the video. What you're going to see is some pictures and x-rays of me after surgery. And of course, I had to go to the grocery store a few days after surgery because I had to get out of the house. So if you take a look at this diagram, it will help you understand a little bit more about what exactly was going on with me. I had a grade 3 slip, which is just a little bit over 50% slipped. In my x-rays, you can see that L5 slipped right over that S1. And here you can see right after surgery, my hardware is in. And this is my incision area before and after. Thank you guys so much for watching this video. I hope this video might have helped somebody, encouraged somebody, maybe after surgery, lifted them up, knowing that they're not alone. Thank you guys so much for watching. Let me know in the comment section if you want me to do an update video. Thank you.